webinar, which is SNAP, what it is and how it can help library patrons and staff. It's presented by Amy Smith. She's an executive advisor for the Department for Community-Based Services, Cabinet for Health and Family Services. This webinar today is sponsored by the Institute of Museum and Library Services, so we want to thank them for their sponsorship of this, and certainly want to thank Amy for presenting. I'm going to share her slides and let her start presenting. So thankful to have her here today, and so Amy, I'll let you take it away. Thank you all for being here to join us.
Well, good morning. Thank you all for being here this morning. First, before I get started, just thank you all for the work that you do. When I was younger, you could find me in the stacks of books in the library. I could spend all day reading books, and the library has always been just a wonderful, beautiful place. And my son and I still go there quite a bit. And so just thank you all for the work that you do and for the safe haven that you provide for families and children. That work is really appreciated. So I'm here today to talk to you about some of the SNAP programs that we have, or the food initiatives that we sometimes call it. And so we sometimes say it's just a collective action to address food insecurity. And you'll see within these slides that we also talk about how our programs are a prevention tool, and how it can also really help with prevention of child maltreatment and child welfare reporting. But with that, we're going to talk a little bit about food insecurity, just give you some statistics. As you work with people in the community, some of this probably will not be news to you, but more than 47 million people in the U.S. face hunger. That is 1 in 5 children. And we're seeing those numbers continue to grow. Hunger is more common in rural areas, and that's due to lack of transportation and other resources, and that can even be employment. That can even be lack of schools and other resources. In 2023 alone, more than 50 million people turned to food assistance for extra help. The highest rate in the nation for food insecurity is among adults 50 to 59, and that's at 17.3. So the national average is 10.6. And in 2022, SNAP helped feed 12% of Kentucky's population, and that's 1 in 8. And currently, a meal for SNAP, like the average is $3.49. So if you think about $3.49, that's not really a lot, but that's what the average meal costs under SNAP. So I always think of the first program and the first step is SNAP outreach. So SNAP outreach raises awareness about SNAP and helps eligible families when they are looking for support. And so SNAP outreach is that first stop for our families. So for every 5% increase in the number of families receiving those benefits, it can also be an 8 to 14% reduction in the amount of CPS and foster care caseloads that we see reported. And that is actually from data and research from Chapin Hall, which they've done about 40 years of research on this. So they provided us a plethora of research in relation to prevention and child welfare. I also find it interesting that when we think about our neighborhoods, our communities, and the hunger challenges they face, 10 of the nation's 25 most food insecure counties come from central and eastern Kentucky. So this is kind of how SNAP outreach works. We have individuals in our community, like, I'm worried about my food. I don't think it's going to last until the next paycheck. I'm not sure where my next meal is going to come from. They can go to our local food banks, and they're going to meet a SNAP outreach coordinator. And they can go, hey, I'm here to help. Not only can we provide food, but we can help you with a SNAP application. So SNAP outreach really works to reduce food insecurity. So how do they do that? How do SNAP outreach coordinators and how does that program help? So they can help with eligibility processing. They can use the tools within the program to help potential applicants with eligibility. They can also help with paper applications and assistance completing that application, as well as delivering that application for individuals. They can disseminate information and distribute those approved program information tools. So within that program, there are information and tools available that we can provide our partners. And then there's outreach workshops, which are SNAP outreach fairs. We can have them at senior centers. We can work with our multiple outreach connections to establish uh, uh, events in the community. We also can have train the trainers for SNAP outreach workers. We offer translations of materials so that we can reach multiple people in our community. We can develop printed educational materials, again, information materials. We can print brochures. And then we can also have contingent activities related to our disaster SNAP. As we've seen this month, we've had disastrous storms, tornadoes, flooding. So disaster SNAP has been issued in specific counties to address that need of loss of food and resources. We also have what we call replacement SNAP. So individuals who lose their SNAP benefits can also have those benefits replaced. And so outreach can coordinate with those services and supports. So our SNAP outreach partners right now are Brighton Center, Catholic Charities, God's Pantry, and Feeding Kentucky, America's Heartland. We are working with Feeding Kentucky to have statewide coverage with SNAP outreach, which we're really excited about. So when we talk about those counties right now that are in that top 25 in the nation, we're hoping that the outreach that we're working to provide will work to alleviate those, take those names off that list, right? And we don't want 10 of our counties on that top 25 in the nation. So we're hoping that SNAP outreach will help take those names off. But these are currently our 4, which provides about 75% of statewide coverage. So SNAP outreach is for everyone, and no one's excluded from SNAP outreach, but we do focus on specific populations. Our students, and that's our students in institutes of higher learning or post-secondary education. We know that our college students are sometimes independent, caring for themselves, and may not reach out for services and support. So we do focus on our students and let them know that SNAP is available. Earlier, I think in 2024, maybe in the fall of 2024, the U.S. Department of Education actually partnered with the U.S. Department of Agriculture and notified students who received Pell Grants and other grants that they might be eligible for SNAP. And that was a federal collaboration to say, hey, you may be eligible for these benefits. You should not go hungry. And a lot of universities also have food pantries and other resources to try to work on food scarcity. We also have veterans that are more likely to experience food insecurity. So states can collaborate with the Veterans Health Administration and connect them to SNAP. But that's also a focus because veterans just may not come to a local office and ask for support, and they might go to their food banks, but we really want to make sure that our veterans are taken care of. Our older adults and seniors, they are historically not seeking benefits. Sometimes it's pride. I don't want to reach out and use those resources, or I don't think that I'm going to receive enough benefits to make it worth my while. So we really want to reach out to our older adults and seniors. We also have a lot of individuals, a lot of grandparents caring for grandchildren. So we want to make sure that they know what resources and supports are available. And then we have our immigrant and our mixed status households. So we want to address any language barriers, transportation issues, or unfamiliarity with any of our organizations so that we can provide the specialized services that they need. We also have, this is also to help address the gaps in our services for seniors, is the simplified assistance for the elderly, and we call this SAFE. And it caters to residents that are a one-person household or married with a two-person household. And it's for 60 and residents that are 60 and older who receive SSI. And it's basically a simplified SNAP application. And they don't have to go through the same stringent SNAP application process, and they don't have to recertify as often. So for individuals that are like, well, this application is long, I don't feel like I can tackle it, the simplified assistance for the elderly helps with that. And then we have the simplified application program, which is similar. We call it ESAP, and it provides assistance to households that are 60 years or older and disabled with no earned income. So they're similar but different. But then the senior participation in SNAP, again, emphasizing that that's low. So for when you have individuals that are coming into your library, your seniors, we only have 4.8 million older adults enrolled in the program. And that's less than half of the eligible seniors that we have. And this is nationwide. So approximately 3 out of 5 eligible seniors are using SNAP benefits. We do, Leah, I'll have to check on that for you. It's been a while since I just saw your comment here, Leah. So I'm going to make a note about that and get back to you. Okay. So just to let you know, SNAP outreach impact. And so this is a quote on the left is from an individual who is actually receiving benefits. This money is supposed to supplement my food budget, but it's really all of my budget. And that's because my income barely covers my rent. So because of SNAP, we're not starving. And then the other quote is, we needed the proverbial leg up. We used it, and today my brothers and I are fully employed taxpayers who support ourselves and our families. And so we really work to remove the stigma that surrounds SNAP, that it is a support that can be there in times of need. And we really want people to know that it's okay to reach out and get that support. We don't want anyone to go hungry. We want people to utilize the service if you're eligible for it. And I think those two quotes just show, hey, I needed it. It was there for me. And it really helped us in a time of need. And hey, I'd be going hungry if I didn't have this benefit. And we don't want anyone to be hungry. And our food banks are wonderful. But again, if this service is available, this program is available, we want to make sure that people utilize it. So I think about SNAP outreach as the door that people walk through. And that opens the door to other programs, which is SNAP education and SNAP employment and training. So the individual is always going to have that SNAP monthly allotment, or that's going to be for them or for their family. But oftentimes they don't realize that there are other things that they're eligible for as well, which is the SNAP education and SNAP employment and training. So again, I just think of it as SNAP outreach. They walk through that door, they apply for SNAP, they receive SNAP. These other programs are part of their service array, so to speak. So SNAP education, again, is offered through the USDA, and it really is designed to help individuals and families make smart choices with how they spend their SNAP benefits, how they use their SNAP benefits. They offer free cooking classes, how to coupon, how to shop, how to cook for I can't speak today, guys. Cook nutritious food safely on a budget, and also how to be more physically active. And then SNAP education works within communities to make food more accessible, and that healthy food. So some of SNAP Education's goals are just to encourage those healthy eating behaviors, promote that budget-friendly meal planning, support that physical activity, and then address that food insecurity. Um, the target audience is really everyone, children and adolescents, adults and seniors. So our implementing agency is the University of Kentucky. Right now, we are looking to expand our partnerships, but right now, the University of Kentucky covers 120 counties, and they do that through our local extension offices, which you guys are probably familiar with. Um, Again, SNAP education is free for any individual that receives SNAP, and there are a lot of services and supports that are part of SNAP education. So the website through UK is called Plan, Eat, Move. And these are just some of the uh, options that are available on the website. There is a great recipe for appleberry salsa with cinnamon chips. And so if you coordinate with one of the local offices, they will even make that and come out and present about some of the great things um, that SNAP education can offer, and they will make that and provide it. It's really good. um, they have an eatable alphabet, which teaches food literacy to your youngest participants, and so you can teach about the alphabets of fruits and vegetables, which teaches children early about the importance of eating fruits and vegetables. For those that love to be connected to the earth and can grow your own garden, they give you a grow your own garden calendar, so you know what to grow when and how best to grow it. And those are just some of those resources that are offered on the website. Uh, so a SNAP fact is that 40% of SNAP education participants eat more fruits and vegetables, and they reduce their intake of sugary drinks. There was recently a bill that made its way to the legislative session this year, and it was, in fact, to uh, remove the ability to buy sugary drinks and cakes and cookies and such. But when you look at the data, most SNAP participants eat less than the average individual of those foods. So they do buy more fruits, vegetables, lean meats, grains, dairy. But I encourage you to check out that website. It's great. It offers a lot of great resources for families. So some other things that SNAP Education offers, they talk about planning ahead, especially in our rural areas. Uh, we teach about canning and preserving. And that's actually a class I've always wanted to take and not been able to yet. And one day I'm going to. But I think it's fantastic that the University of Kentucky offers that class. It offers recipes, meal planning tips, coupons, how to clip coupons, and then how to store leftovers properly. SNAP Education also offers, eating well, like your cooking and food safety basics, understanding a portion size, how to actually start cooking with kids and building those healthy habits, understanding nutrition basics and macronutrients, food facts, understanding the benefits of our farmers markets, which we have some amazing farmers markets around here, and then using the My Plate, which has been a staple of our program for quite a while. And then Get Moving. Obviously, we want to eat well, but we want to stay active. So it offers how to get started, right? If you're not used to being active, how to get started, or how to add just a little incremental activity into your daily life. The calorie burning by the numbers, as far as if I eat this many calories, how many calories should I burn? And then again, growing your own garden, which incorporates the healthy eating and the activity of being out in the sun and working in your own garden. These are some of our community partners. I'll just name just a few: Bluegrass Farm to Table, Community Farm Alliance. We work with them with our Double Dollars program, which can double the benefits that SNAP participants have to purchase healthy fruits and vegetables and um, local ground beef, for instance, or local meat and dairy. The Kentucky Department of Agriculture is a great partner. The University of Kentucky and the USDA. We have multiple wonderful partners um, that are all invested in seeing Kentuckians be healthier. And then the State Nutrition Action Council, which actually started in 2017, it requires states to establish this council. But what I love about this council is that it brings all of these wonderful partners together who are so committed to seeing Kentuckians live healthier lifestyles through the use of healthy foods and activity. But we focus on how we can integrate our work together. And actually, KDLA has joined, and we're so glad that you guys have become partners on this journey with us. And there's some great things that are happening. Roger McCann is actually on this call as well, and maybe at some point he can talk about some of the actions that were happening in different communities. There's an activity, an event that's happening in Clay County next month, and there's just some wonderful things that are happening when people get together that are so committed to providing healthy spaces and opportunities for families um, in our state. So just really excited to be a part of the council and really excited that you guys have joined us. And then we also have our SNAP Employment and Training Program. Now, SNAP education is open to everyone. We have classes all the time. It's wonderful. But SNAP Employment and Training is a little more specific in what it offers. But I think it's actually one of my favorite programs, because what I think it does is it has the potential to transform individuals' lives. So when it says empowering people and pursuing pathways, it truly can empower people. And I'm going to tell you a couple of stories along the way. So SNAP E&T is another program, again, offered by the USDA. It's kind of in that SNAP umbrella, but its goal is to empower people by providing them skills, education, and training to help them have meaningful long-term employment and reach self-sufficiency. So for SNAP employment and training, individuals participating in the SNAP, they have to have SNAP benefits. So they have to be receiving SNAP. They have to be between the ages of 16 and 59 years old. They have to be willing to participate in the program right now. We have what we considered a voluntary state. Some states are considered mandatory. I'm not going to get too much in the weeds there, but right now it is considered a voluntary program for the state of Kentucky. You have to be eligible to work and meet those state and federal work requirements and meet general eligibility screening criteria, which are pretty simple. But it is designed for individuals whose needs and goals are aligned with our services that are offered. And we are constantly looking at expanding our opportunities for individuals in our state. So I'll take you through an example here in just a minute so you can see what it kind of looks like a little bit more. But for an individual who is receiving SNAP and is interested in gaining skills so that they can move up the ladder, so to speak, at work, or pursue a different pathway, or get an education where maybe they have felt a little hesitant to do so. SNAP E&T has different components that can help provide building blocks towards that successful outcome they're looking for. We have supervised job search, basic foundational skills, and that instruction includes maybe even getting your GED or your high school equivalency, participating in a high school equivalency program. They can include career technical education programs or vocational training, integrated education and training, or what we call bridge programs, work readiness training, or transitional jobs, which are limited, unsubsidized, work activity or work experience, job retention services. It can even include apprenticeships, um, and those are some things that we're looking at, and including even internships. So lots of opportunities within this program. Some incentives that we offer within SNAP employment and training is that you get a great case manager. So as once you decide to be a part of employment and training, you're going to go through a comprehensive intake assessment because we're going to create an individualized service plan. Um, so we want to make sure that when you start this journey, that the program is tailored for your life and your needs. So we don't, if you want to become a welder, we don't want to set you up for failure and have you go down a different path. We want to make sure that we set you up so that you can get the licensure that you need so that you can follow that path. So that individualized service plan is created with your case manager. And then the case manager will also provide progress monitoring to make sure that you stay on the path and address any pitfalls that may happen along the way. And they will also coordinate with different service providers to make sure that you have those wraparound services that you need. And then if you say, hey, I thought this was what the path was for me, I thought this is what I want to do, but I'm in the work and I think I want to do something else, then you can reassess and redevelop that individualized service plan. That service plan is always a proactive plan. It's never something that's completely set in stone, and it can travel with the individual and change as that individual's needs change. You also get a coach and an employment specialist. So you're never alone on the journey. You're going to have a case manager and that coach and employment specialist to help guide your path. We offer a 25 transportation reimbursement monthly. We are looking at trying to increase that, but right now that's offered before, like upon signing up for E&T. So you get that prior to, you don't actually have to have that month of transportation, you get it prior to the transportation. We also talk to you about child care assistance and help with child care assistance if that's needed. And then again, we reinforce that SNAP education class and those resources so that you remember that those are always available to you. We also, once we get you set up with a partner and get you on your way, we can also pay for books, for uniforms, and all the different tools and resources that you need um, to fulfill your goals. So what I like about this slide is I think it kind of takes you a little bit through visually of what this may look like in practice. So for this individual, they are looking at nursing. I want to become a nurse, or I want to become, I want to be in the nursing field. So they're meeting with a case manager and they're receiving that one-on-one support. They're going through soft skills training. They are meeting to uh, create that individual service plan. They are building that team around this individual so that they have that strong foundation. And it's determined that they need an education. And they start to take classes. They build that foundational knowledge that they need, right? And that is supported through, let's say, for instance, KCTCS, and they're taking those courses. And along with that, they're also getting skills training. So not only are they getting the education they need, but they're getting that hands-on learning that they need so they can combine both of those educational experiences. So then when they're finished with that, they can go into a career and have a sustainable career and then build on and continue to learn. So those options are available to that individual. And so again, they go from that case management support and that dream to that career sustainability. And that's something that SNAP education, SNAP employment and training can offer. Leah, I see a question and I'll answer it here in just a moment. I met an individual once, this was a few years ago. He was sitting on his couch and he was debating, like, he was on SNAP and he was like, I want to I want to be a mechanic. I don't know what I'm going to do. And he got connected with SNAP employment and training. He started taking classes at KCTCS, and we offered we had a partnership at the time with Mercedes-Benz, and he started going through the stackable credentials of becoming a mechanic through Mercedes-Benz. And when we met, he had already received like 2 or 3 stackable credentials, and he was coming off of SNAP, and he had been offered um, a position that was making much more than I was making at the time, and he was being sought after by other states because of his experience. And he attributed his success to SNAP E&T. Like, here I was with this goal, thinking I could never do it, and then I got connected to SNAP E&T, got the training and education I needed, and now I have the confidence to continue to build and make more money than I ever dreamed of. I no longer need SNAP because I'm making enough money and much more money than I ever received on SNAP. The average SNAP benefit is $211 nationwide, and I'm making much more than that. And I'm so grateful for the program because it gave me the pathway and the confidence to pursue my dreams. And that's just one example of many of what SNAP E&T can do for individuals that are motivated to go through the program. So Leah, does SNAP E&T work with those with physical and mental disabilities whose ability to do certain work is limited? It can, depending on if that's something that they want to participate in. Yes, that is something that they can do. So we would take them through that same process, and I mean, everybody's goals and dreams are valid, and so we would just take them through that process, and we would work on an individualized plan for them. Caitlin, we offer translation services as a cabinet. We have certain languages that we automatically translate into, and we work with partners on translation. So we are always working on translation and translation services. So, but if there is a need out there that is not being met, we would work to meet that need. So I would like to say that yes, as far as we're concerned, we're going to work to meet that need, and we would work with our partners to try to do the same. So I hope that answers it. There are a lot of languages out there, but we do work with a lot of translators, and we are constantly working to improve our translator services. I will say that I actually worked for DCBS and some years ago, and went and took a position, stayed within the cabinet, but worked in our analytics office for a while, and then came back to DCBS and was amazed at how much our translation services had improved in the office, because that was always a passion of mine. So I know that it is continually improving, and just know that we will always try to work with our participants to provide the best experience possible. You're welcome. So we have what we call providers and partners. And so initially, an individual will be referred to a provider, which is where their case management occurs. And these are our 5 providers: Audubon Area Community Services, Big Sandy Area Development District, Central Kentucky Community Action Council, Goodwill Power of Work, and Northern Kentucky AD. And that covers the entire state. So any individual that signs up for SNAP E&T would automatically be referred to an E&T provider to establish case management and to start working on that individualized service plan. Now, they may stay with the provider if what they are looking for can be met through that provider. However, we do have additional partners. We work with Brighton Center, Center for Employment Opportunities, which is a second chance employer, Family Scholar House, Goodwill, which is largely in Jefferson County and in the West, Bullitt County, KCTCS, Colleges and Campuses, which is statewide, and then Northern Kentucky Community Action Commission. And so you can be referred to an E&T partner for that more specific skill set that you're looking for, just like nursing, welding, coding, whatever that participant is interested in. And that's why we're always looking to add more partners so that we can provide more opportunities for individuals who are interested, because it's just like anything. It's just like when you go to college, right? Or if you go and you're interested in multiple subjects, we're trying to provide multiple opportunities for individuals so they can pursue their dreams. So this is the life cycle of a participant in SNAP E&T, and this is just a general um, pathway, um, just so that you kind of get a little bit of a feel of what that looks like. But that participant is referred to that E&T provider, and then that provider will set up that appointment for the participant. So that ENT provider will reach out and say, "Hey, Amy, let's set up an appointment, and then we'll get you set up with the um, with your your person, your go-to, and we'll get that plan in place." So that participant will complete their assessments with the ENT provider, and they'll also get that initial transportation request initiated. So they'll get that initial $25 started. Then that participant will be enrolled in a component with that ENT provider or that ENT partner that I just mentioned, based on their needs and based on that plan that they create with their case manager. And then they are considered fully enrolled in the SNAP E&T program. So it's really simple. They meet with that case manager, they develop their plan, and then we get them enrolled in the services and supports that they need. And then we monitor and we continue to provide those wraparound services and support so they can continue to be successful on this journey. I know this is a lot of words, so I'm not gonna read these to you, but we just do a lot of great collaboration in the community. Again, libraries, you guys are so instrumental in the community, but we work with community-based partners. We work with uh, childcare providers. We work with transportation. We work with anyone who can help support our community and our individuals. So, but I truly believe that SNAP E&T offers a pathway toward opportunity. And that's one reason that I love the program so much, because uh, I've seen it in the participants that we've talked to for years, that when they go through the program, they say, "It's changed my life. I didn't think that I could do this, and now I'm doing this." We met a lady one time who didn't even think she could go back to school, and didn't think she could go to school and work. And when I met her, she was going to school full time, and she was working as a manager at Panera. So she was making money. She was coming off of SNAP, and she was going to school, and school was being paid for. So she was thrilled that she was able to pursue this pathway, and but she did not feel the harshness of a benefit cliff because of how the program was set up, which was also a nice benefit as well. So she got to see the maximum of that payoff working without feeling like she was falling off this benefit cliff. So again, it promotes that economic independence. So the USDA and advocacy groups again support this program because they see it as a potential to break those cycles of poverty, because it equips individuals with those resources and skills needed for long-term employment. And we really work on that long-term meaningful employment so that individuals can be happy and have that economic stability. And research has shown that when there is stable parent employment, it leads to a reduction in child maltreatment. And so, again, when we think about concrete supports for our individuals, this is another concrete support that prevents child welfare calls and maltreatment, and reduces the individuals that are in our care. And it keeps our families together. Um, I always have to mention our SNAP connectors. Because they're also an additional resource for us. They are trained citizens that work with different organizations, and they can also help with SNAP applications. They can initiate those SNAP applications. They can assist Kentuckians in our Connect system, which I'm pretty sure you guys are familiar with. They can provide guidance. as far as how to navigate the SNAP process. There are some limits on what they can do, but they are a huge resource in our community. They can review verification documents and help upload those. And then they also can help distribute messaging. So our SNAP connectors are an important part of helping our individuals in the community who have reservations about applying for SNAP or feel overwhelmed by the process. Um, and so we really value our SNAP connectors. So food security is, again, it is a prevention pathway. In 2023, SNAP served an average of 42.1 million participants per month, which totaled $112.8 billion. And again, there's that $211.93 per month. Chapin Hall did some amazing research, and through that research, I learned that $100 a year could make a tremendous difference in the lives of a family. It could actually prevent a family from having a CPS call or a referral made. And I think about $100. What does $100 mean to me? What does it mean to others? And $100 can literally keep a child healthy and happy and supported in their home. In 2022, SNAP benefits and emergency allotments raised 30% or raised families 30% above the poverty level. And so we think about if $211 is what on average families receive, it took 30% of our families out of poverty. Think about that. Just $200 raised people over the poverty limit. We also saw a 10% decrease in food insecurity in 2022 based on the USDA data. And then 98% of children on SNAP qualified for direct certification through the National Free and Reduced Lunch Program. It's 98%. So when we invest in SNAP, not only do we see that it keeps families from going hungry, it also prevents child welfare referrals and calls. So it has a multiple benefits. We also know that, and while I don't have a slide for this, we also know that it gives back into the community. So for every dollar that is spent in SNAP, it gives back to the community. I think $1.54 goes back into the community, is the last statistic I saw. So SNAP actually contributes to the economy. So how can libraries help? And these are just some ideas. I know that there has been a lot of conversation about the great things that libraries do and how you guys want to be a part of the solution. So information application assistance, workshops and information sessions. We can help host events where people can learn about SNAP eligibility and how to apply. There can be one-on-one help partnering with us, DCBS, and helping filling out those applications online or on paper. Leah, I know we talked about multilingual. There's that multilingual support for providing forms and help in multiple languages common in the community. The connections to SNAP education, cooking classes, collaborating with local chefs, bringing in our SNAP educators or health departments to host cooking demos, using those EBT, which is again our SNAP friendly ingredients, meal planning resources, providing books, handouts, and online tools for healthy meal prep, and then encouraging our library card usage for cookbooks and meal planning, because you guys have some great cookbooks. Farmers market partnerships, promoting those partnerships with family farmers markets that accept EBT and SNAP, and setting up mini farmers markets near the library. So promoting healthy eating and reading your favorite book at the same time. And then again, connecting outreach, partnering with local food banks and our SNAP educators, incorporating WIC and our other nonprofits and co-host events and services. And then utilizing the mobile libraries, which I know we've talked about too, but what a great resource that is to reach out to families, especially those that are struggling with transportation needs, and meet our citizens where they are. So, what can DCBS do to support your endeavors to reach SNAP eligible populations, and how can we work together? And then, what other questions do you guys have for me? You can put them in the chat or you can come off mute. Let me know what questions you have. And then, Roger McCann, who is my partner in crime in SNAP, he's on the call as well. So, Roger, if you have anything that you'd like to add, please do so. I definitely could not do this work without him. He's a great partner, but would love to have any questions or comments from you guys.
Amy, can you hear me?
I can.
Oh, good. Well, let me tell you, y'all, I came on here just to see if Amy was going to do a good job or not. And as she was talking, I kept writing down things that I was going to mention that she hadn't covered. And the problem is every slide she would mark off something else that I was going to say. So she did a very thorough job, and I think is fantastic. So I appreciate her, and I can't do my job without Amy. So, but to Amy's point, the cabinet, operates these huge programs, Medicaid, SNAP, TANF, and we largely work out of Frankfurt. But the community is where these things happen. It's that local farmers market. It's that SNAP education class where we're teaching people how to cook, green beans without putting too much ham in it, because that's how I grew up. And making the better choice about it and being healthier and stretching that food budget. And it struck me when I went out and talked to librarians across the state. They said, people come to us and say they need help. And so it just strikes me how important the library is in the community, and how our partnership can help folks, prevent child welfare issues, prevent chronic disease, and try to bring these programs to the local community where they can do the most good. So I appreciate y'all just letting us come on here and talk today, and look forward to working with y'all in the future. Amy, that's all I've got to say because you covered everything else. You did a good job, so thank you.
Thank you. Yeah, please, anyone, if any questions, what is the best way to contact our local SNAP connector in order to set up workshops, info sessions, or private one-on-one help? Can we act as a meeting place? You can act as a meeting place, and we can get you a list of SNAP connectors. So, Hillary, I think we can email you that. Would that be the best way to get that out to everybody?
That would be wonderful. Yes, please, Amy. Thank you. And Leah,
Okay, we
you
can
asked
do
a question
that.
I was going to ask.
All right, so I'll get that out, and then we also can give you a list of our SNAP education um, contacts, so that you can also utilize them as well, because they'll come out and they can do different things for you too. So you might be able to even coordinate it with your SNAP connectors and our SNAP education coordinators. So we can get that information to you. And like I said, they're great about coming out, and either SNAP connectors can come out and provide information, set up, and help with applications. And then educators can come out and even talk about the benefits of programs, classes, and even create little goodie bags of food, which is always really nice. People love that, right?
Amy,
What other questions?
oh, go ahead.
No, I was going to
Amy,
say what other questions. So yes.
So we just had a webinar a few weeks ago about summer feeding, and that's for that many libraries participate in. But we talked about a little bit in that webinar about what about the adults who come, but they aren't able to participate, or they can't. They're not able to take that food. How could libraries, if they know somebody in need? I've heard from other library staff across the state about they see older adults who are in need. what's the referral process, the best way to gently talk with somebody or get them connected to DCBS staff so that they maybe can get some assistance if the library staff's aware of a food insecurity need?
I think, and Roger definitely chime in as well. I think we could probably get you some materials and resources um, to maybe help spur that conversation. That way, you've got those resources of, hey, if you know someone who needs that support, reach out to, hey, reach out to Amy, and this is the information here. This is the local, this is the number. But hey, if you reach out to so and so, they can help support you and see what you're eligible for. And they're really nice, and there's no judgment, and because sometimes that's what we're seeing with our older population. There's that pride piece, or I don't need that, or I'm only going to get $23, and that's not really going to help me, or that seems like a lot of work. And so I think having those resources and tools, we're focusing on plain language as well, so that we take out some of the confusion um, and make it simplistic, because we understand our programs can sometimes seem complicated, right? So if we make them we make them more simplistic, people seem less intimidated by them. So um, I think providing those resources and support and getting that in your guys' hands is really important to help facilitate those conversations. And so that's something that we can talk about too. Um, because again, like I said, we're really trying to change the stigma around it, but that takes time. So that's something that we can start with. And again, we want to keep the line of conversation open. So, if we provide something and you say, hey, this is great, but we're finding that we need A, B, or C, that's something that we can work to provide you as well. I'm going to go back here through the chat a little bit too. Let's see. Would libraries also be a place that caseworkers can meet with their clients? Is that something we can advertise? I will tell you that I will. We have a director of our service regions. Her name is Marjorie. I will ask about caseworkers meeting with clients. I'm not sure, but I will find out. So, Leah, you asked some great questions. And is there something that we can do for housebound folks? Again, that's a great question. That's something that I think that we struggle with, is how do we reach those housebound individuals? I love the idea of we say DCBS, we want to have our own caravan. I would love for us to have our own DCBS caravan and be able to go out to houses and help people. So I'd say that we're still struggling with that. But it's definitely on our radar as far as our housebound individuals and how we serve them best.
Well, Amy, you had mentioned those resources that you plan to share with me. Is that those? I mean, if Leah, and thank you, Leah, very much for asking these questions. It's a very good conversation, dialogue. If Amy, you share those with, if there's a one sheet or something that the bookmobile librarians, and those are our mobile libraries, bookmobile and outreach librarians take, and they can have on their bookmobiles. Would that be okay? Do you all have? And then
that would be fine. Yes.
Okay.
Yeah, we can do that. Yeah, and you're more than welcome to share that. And then if there's someone in need specifically that we could try to maybe Roger, I don't know if that's something that we could try to maybe get a SNAP connector out there too, and maybe we could help facilitate that. Maybe that's something that we can do for those housebound individuals that need more support.
We can have a SNAP connector who can assist with SNAP and child care applications. We can have a full connector who can help with enrollment in Medicaid or health insurance, as well as SNAP and child care and other things. So they will do home visits. We could have an arrangement there. There's lots of things that we can do there. I just want to mention too that we are in, for example, in Clay County, the librarians invited DCBS staff to come and work a couple hours a week. Maybe not a couple, maybe like an afternoon or even a day. And they're setting up the schedule to their, what they think suits them. But so we're going to have DCBS staff go and be able to do full service right there in that library. We have another one that we're looking at doing some work related things with as well. So if you've got an idea about what you would like to do, or if you have something specific in your community that you would like to address, we're open to that conversation. Every community is going to be different. The needs of folks in one place are going to be different from another, and so we want to try to bend and stretch to fit the community. So please get with us, and we'd love to have those conversations.
Yeah, and so Leah, especially since you mentioned that, especially with the clients and meeting caseworkers with clients, reach out to Hillary with ideas, and she can connect you to me and Roger, and we can see what we can get done. But especially for housebound individuals, I think that would be the way to go. Get that information out to them, and if they are interested, we can get a SNAP connector to their home and help them with applications. If it's depending on what they need. If it's Medicaid, if it's SNAP, we can make sure that the correct person gets to them. And then also to address your question about SNAP and the most current legislative session. Statewide, there wasn't anything that passed as far as the state legislature regarding SNAP. So there will be no changes to our program from a state perspective. We don't know anything as far as federally. So I can't comment on that. We don't know anything, but I don't foresee any changes at this point, or can't predict any of those changes right now.
Any other questions? Thank you all. Thank you, attendees, and thank you, Roger and Amy, for just dialoguing about this. I think Amy and Roger can see that our library staff are very passionate about helping their community members and learning about ways that they can help. So I appreciate you all and your passion for helping folks too. You're trying to connect them, forgive the connector pun, with folks. So thank you all thank you, Amy, for presenting, and Roger for being here. I'm going to drop in the chat a survey so that library staff can share their feedback. And but I just want to thank everybody for being here and the desire you have to help people feed their brains and feed their bellies and their bodies.
Well, thank you,
Go ahead, Abe.
I was just going to say, well, thank you everyone for allowing us to speak today on something that we care about. And Hillary, thank you for allowing us to speak about it. And please reach out. It's something that something I definitely care about, something Roger definitely cares about. We spend a lot of time talking about this and how we can improve outcomes for families and individuals. So we want to collaborate and work with like-minded individuals. And so we really appreciate you being here today and listening to us go on about it.
Well, no, thank you so much again. And I'm going to just do some quick housekeeping as we wind down this webinar. The slides are available in your online portal, and this webinar was recorded, so it will be made available in a week